this matter. Our request fell on deaf ears. Reports indicate that the majority of incidents relating to drug exposure occur with drugs coming in through the mail. There are 6 states now that are doing electronic mail scanning. I signed on to Representative David Freese's House Bill 5893, which calls for an electronic mail program. We should be taking every precaution necessary to keep our prison workers and our inmates safe. The Department of Corrections should take every immediate step possible to ensure the safety of employees and inmates. We want details as to what they are doing to protect those interacting with the prison mail. These aren't just stories of drugs and substances coming in through mail itself. I'm hearing from people in my district who are prison guards that mail is being left laying on the floor, and when the prisoners ask to have their cells fumigated because of bugs, then they turn the tainted mail into cigarettes using batteries to light these cigarettes. Of course, many prisoners then get sick. Just this week, several House and Senate Democrats sent a letter claiming that receiving a physical mail somehow improves public safety and increases rehabilitation. It's simply common sense that if our constituents who work in these facilities are telling us that the drugs are coming in through the mail, we should polish physical mail, at least until we get and can figure out what is going on. These aren't just stories to me. These are our prison workers. These are our healthcare workers that deal with the affected prisoners. These are mothers, fathers, and they are not lying. They are Illinois citizens who have the right to a safe work environment. Our letter to request a hearing to gather information from the people who are on the ground was ignored. Everyone should agree that if there's a threat to the safety of the inmates and the employees, we need to quickly get to a solution. I'm standing up here with representatives who have constituents who work at these prisons, who experience these incidents every day. The Department of Corrections has given us a 7-month timeline for a pilot program for the electronic mail system. This is too long. We don't have 7 months. In that time frame, how many more people will become sick or possibly die as this situation spirals into a prison epidemic? We are not calling on the committee to only discuss these procedures. If there are other ways that drugs are pouring into our prisons, we should address that too. We want our constituents and deserve answers. I'm calling on the Illinois Department of Corrections Acting Director, LaToya Hughes, to join me at any one of the correctional facilities that have experienced these drug exposures. Together, her and I will go through the mail. If she is confident that the drugs are coming in through other means, she should have no problem with doing that with me. At the very least, she owes it to the citizens of Illinois to provide answers and solutions to the issue, preferably through a committee hearing. At that hearing, she can give us some much needed information. She can hear from the prison workers in each of our districts that are affected by this, and we can come up with a solution that's good for Illinois. It is imperative that this hearing takes place before Acting Director Hughes' confirmation hearing. With that, I will pass this over to David Freese.
Thank you, Charlie. Good morning, everyone. I want to take a moment to acknowledge the men and women who serve in our correctional facilities every day. These are people who leave their families at all hours of the day and night, putting themselves in situations most of us will never face to ensure the safety and order. They deserve our gratitude, and they deserve to go to work without fear for their lives. In my district, at Menard Correctional Center and Pinckneyville Correctional Center, we've seen multiple instances where staff have reported serious symptoms after inmates have smoked their mail. Since late August, these events have put the facility on extended lockdowns and landed hardworking correctional officers in emergency rooms. The preliminary findings from Menard and other facilities across Illinois are alarming. Synthetic cannabinoids, chemicals found in insecticides, and even fentanyl have been recovered in some cases. It's disappointing that our request for a hearing has gone unanswered by the House and Senate Public Safety Appropriations Committee. We're simply asking for the opportunity to explore solutions and ensure the safety of our correctional officers and inmates. Instead, We've seen a letter from several representatives of the majority party stating that mail services should continue despite clear evidence that this is how dangerous substances are entering our facilities. While we all have valued the connections that physical mail provides, it's hard to ignore the very real risk to safety that comes with it right now. At the same time, we need stronger leadership from the Illinois Department of Corrections. Thus far, there's been little clarity or accountability from the acting director. We don't have a clear picture of how these instances are being addressed or what steps are being taken to protect those on the front lines. For the people I represent, those who work at Menard Correctional Center and Pinckneyville Correctional Center and other surrounding communities, these issues hit close to home. These are dedicated individuals who deserve a safe working environment, and I believe they're owed more from the leadership tasked with supporting them. The safety of our correctional officers, staff, and inmates must come before anything else. Physical mail has become a clear pathway for dangerous substances to enter our prisons, and immediate action is necessary. As Representative Meyer mentioned, 6 other states have already adopted electronic mail scanning. I filed HB 5893 to deal with this immediately. It's a proven measure that drastically reduces the risk of drugs entering facilities while still allow inmates to maintain communication with loved ones. I stand with Representative Meyer and my colleagues in calling for immediate action. This issue is personal for me and the communities that I serve. Menard Correctional Facility and Pinckneyville Correctional Facilities are part of my community. The people who work there are my neighbors and my friends, and I know their families. And I know the same is true for the other affected facilities. We need transparency. We need solutions. And we need to know that the safety of our correctional officers and inmates isn't being put on the back burner. It's time to act before this crisis deepens. I will now introduce Representative Howder. Thank you.
Thank you, Rep. And good morning. Thank you for having me, and thank you for coming, and thank you for being interested in this topic, because I certainly am. I am the state representative for the 87th district, which is Morton, Clinton area, Lincoln, Illinois. In Lincoln, in the county of Logan, is Logan Correctional Center and Lincoln Correctional Center. And both of those places have had incidents relating to exposure to an unknown substance. And in my opinion, that's a key thing. It's an unknown substance. We don't know what this is. And so I am, some of you may know, I'm an emergency physician as well as an anesthesiologist, and I know what it takes to handle some of these controlled substances and the safety that goes into it. Some sort of biohazard is being introduced, some drug or controlled substance is being introduced through mail. And it is a dangerous situation for not only the workers but also for the prisoners. And in addition to those people, it's a danger to the healthcare workers of Illinois. And so I'm going to take a little bit of a different tact and a different perspective on this. When we get somebody who is an exposed person to an unknown substance, the amount of time and healthcare resources that goes into trying to find out what it was and how to treat it is very expensive to the taxpayers of Illinois. So that's another example of how this incident or these incidents are affecting the taxpayers of Illinois, not just the workers and the prisoners. So I was on I was at the AFSCME protests or picket line just a few weeks ago. And there was many incidents that they reported that they had to be transported to the hospital. Workers had to be transported to the hospital. Prisoners had to be transported to the hospital. That's an excessive use of resources. So I'm just saying that this is one of the reasons that we need to take this seriously. And I call on the Department of Corrections to protect workers and the people that they are charged with taking care of, the detained prisoners of Illinois. So thank you.